Okay, welcome, Pahrump. This is Dr. Michael Reiner, your host on the Independent Doctors of Pahrump. Tonight is a live show, so I know that sometimes they run reruns, and sometimes it's hard to distinguish between the live shows and the reruns. But this one, it actually is a live show. So if you're last time we had a good caller in base, we had 4 calls, and I certainly appreciate those calls. And if you're so inclined, there are no questions that are too stupid or too dumb. I've always believed that the only dumb question is the one you don't ask. Nobody can see your face. You don't even have to say your name except to the gentleman who answers the phone. You can even make up a fake name. I don't care. But if you have a question, call in and we'll see if we can't answer it for you. Previously, Ray the Flagman called in, and he had a question about some gold microspheres that were being used in some type of cancer chemotherapy, and did a little research on that, and those are indeed what I thought they were. They were actually microspheres that were being used to sensitize certain cells for destruction by either ultraviolet radiation or some type of additional chemotherapy. Still investigative, still hard to say whether or not that be a part of what we call modern therapy. But you know, as a drug or any product gets developed, it goes through a series of clinical trials. First, they do it in what they call stage 1, stage 2, and clinical trials, and then they assume some safety issues, and they do animal studies, and then they basically go into human studies, provided obviously that the animal studies are safe, and then they do what they call double-blind crossover placebo studies. And I think I've talked about that briefly on this study, but what that particular type of study is you have 2 control groups. One receives a medication and one does not. And then they cross them over and they look at the statistical differences that both populations exhibit off and on the drug. And now, each group doesn't know whether they're taking the product or some type of placebo, so that the measurements can be ascertained. Sometimes during the clinical trials, the studies are halted because the results are devastating and we won't continue anymore. Sometimes the results are so good they basically bring the data to the FDA and try and get the product approved if it shows clear and statistical difference. And therein lies the key, statistical difference. A lot of drugs released in the United States are not drugs. They've been tested in Europe, but Europe has a different society for reporting adverse effects, and of course they aren't a litigious society like ours, so therefore, I mean, you see almost as many commercials on TV, late night TV, for lawyers as you do for drugs. And it's an amazing thing to have to bear, and especially for me to watch the drug companies advertise their medications, and yet, you know, half the truth isn't really particularly stated, and if you heard all the side effects, you probably wouldn't want to take them anyway. But that being said, they still want to get your mind thinking about these medications and asking that question to your local provider. And certainly, I don't mind having that discussion with my patients. I think if there's something they hear on TV, something they're curious about, we certainly like to bring those discussions to the forefront, just so people understand what they're taking and certainly what they're up against. Now, lately in this community, we have seen a resurgence of this bad. I've been seeing it for the last week and a half to 2 weeks, this very nasty bronchial cough and cold situation that has developed in our community. Starts with a severe upper respiratory infection, head congestion, and then goes into this very deep-rooted, gaggy, bronchial type cough. I suspected some form of, influenza, and certainly this may be what they're talking about, this type of epidemic. It's not really associated with nausea. I called the pharmacy the other day looking for some Tamiflu for a patient. They were sold out. So apparently a lot of people are using Tamiflu. And that product by itself has a limited ability. It's usually a 3 or 4 day course, and understand that it is only useful in the first really 24 to 36 hours of developing those symptoms. I've had some success with some limited antibiotic use and Biaxin for the late phases of that. People seem to respond to those bronchial infections with that. So if you are ill, and if you have some other illnesses like diabetes, high blood pressure, some type of heart disease, especially if you have emphysema, I would encourage you to contact your provider, get in and get seen, so that you maybe can try Tamiflu. It may be a limited effectiveness, but there again, something might be better than nothing, especially if you have another illness that you're trying to prevent from becoming worse, certainly if you have COPD. As I've discussed before, I don't like the overuse of antibiotics, and I think in this condition, if you have another condition that could make it worse, I think in some limited usages, Biaxin or other antibiotics may be useful. And the reason I like Biaxin is because it is erythromycin-based, although obviously some people have allergies to that. But as I discussed previously, in order for an antibiotic to be an effective killer, it has to have a concentration of that antibiotic in the area you're trying to treat that's greater than what we call the minimum inhibitory concentration. And MICs are that term, and MICs are different for every location. They're different for a hospital, they're different for my office, they're different for everything. It's because where the bacteria is received in your body and where the infection starts would determine how resistant that antibiotic is, and that's what that MIC is level. So if an MIC is elevated for a particular strain of, let's say, Staphylococcus or things of that nature, what that means is that it will take a higher concentration of certain antibiotics to kill that bacteria. Now remember on a slide, and I may do that after we come back from the break, talk about that bacteriostatic, bactericidal. Basically what that means is it doesn't really matter. It just means that if I can achieve a concentration of that antibiotic in the area I'm trying to treat that's greater than the resistance of that bacteria, I will hold it or kill most of it until your immune system comes in to clean up the mess. Therefore, it is important for you to have a good intact immune system. And with that being said, diabetes is one of those illnesses where during a cold and flu season, it's very important to control your sugar. And as I said before, if you have diabetes and elevated blood sugar, your white blood cells are not going to be effective. And they're not going to be as effective if your blood sugar is well controlled. Again, imagine that you have this sticky glue-like substances in your bloodstream, which is sugar. And your white blood cells now have to manipulate their way through your arterial system to the site of the infection and do their job. And it becomes much more difficult if there's a high sugar concentration, because everything, you know, look at honey, it becomes everything doesn't move well. So that being said, if you have diabetes and you get sick, it's going to be harder to treat that. Not to mention the fact, if you're a diabetic and you know previously if you've gotten sick, that your blood sugars go much higher during an illness. So during cold and flu season, it's very important to really be careful and not let your sugars run amok, so that you can help get your immune system better in check to be able to fight off these illnesses. So again, back to the MIC, remember, it doesn't matter how well I soak you. If you don't have an immune system, you basically have to have the right concentration of antibiotics. Anyway, we're going to go to break. Come back, I'll bring up some slides, and we'll talk about a few other things. And thank you for tuning in tonight.